Thank you very much. Distinguished guests, ladies and gentlemen, I'm here today to tell a story of hope and a story of how things can happen when somebody is HIV/TB co-infected. 16 years ago, I got to know that I was HIV positive. Little did I know that 10 years down the line, I would have been one of the statistics in relation to dying from a disease despite being in an era whereby antiretroviral therapy is possible. I want to say that we are in a situation in which people living with HIV are dying of TB, despite the fact that TB has been curable for over a century. To me, as a person living with HIV, this is totally intolerable. TB is the leading killer of people living with HIV and AIDS, and we know that we are now at crossroads with the emergence of multi-drug resistant TB and also XDR. And thus the need to be able to scale up in relation to TB HIV so that the gains that have been made in relation to the fight against HIV are not eroded. Progress in the treatment and care of TB and HIV among the co-infected populations is not only possible, but it's proven. Through TB programs, rapid scale-up of HIV scale-up has been achieved in several countries. I come from Kenya, and Kenya has been one of the countries. Rwanda too has set a good pace, Zambia, Malawi, and Tanzania. The Brazil and South African models have proved that TB/HIV can be a success even through the HIV programs. Now in Kenya, we have seen that this too has been possible, and I just want to share some figures with you. One is that because of the collaborative effort, Kenya has been able to hit the case detection of 70%, and most importantly, the treatment outcomes of 85%. Today in Kenya, over 80% of HIV-infected patients have access to cotrimoxazole. 80% screening of TB patients in relation to HIV. That is good progress. We also have an 80% leakage in relation to TB patients who turn out to be HIV positive being referred for antiretroviral therapy. That is good news. The challenge for Kenya has been screening of people living with HIV and AIDS in relation to TB. But I'm glad because of the partnership and the government's commitment, things are turning around to a point in time that the Ministry of Public Health and Sanitation has actually just launched a campaign considering that they want to turn this challenge into an opportunity whereby each and every person living with HIV and AIDS must be screened for TB. And I got very excited when the permanent secretary actually stood up and he said, we must be able to implement this. And if we do not implement this, this is mismanagement. And for me as a person living with HIV and AIDS, I would look at it as malpractice. Now, these countries have been making better progress in relation to TB/HIV, and they are moving beyond universal access. This proves that if these countries have actually done it, what excuse do we have here seated in this room not being able to offer TB screening among people living with HIV and AIDS? We need to make sure that every person today is tested for TB, offered HIV testing, and once duly co-infected, being able to have care in an environment that is safe. Why do I say in a safe environment? I would hate to see a scenario, and I'm going to say this because I have worked in a TB/HIV clinic, and it's not always easy to see the numbers of patients who are queuing up on the line, and yet considering that that also becomes an avenue whereby the other people living with HIV can actually get exposed to TB. So we require an environment that is safe so that people living with HIV do not pick up TB as they access their antiretroviral therapy. Now, what is lacking to make that difference? I just want to talk about two things. One is the human-based approach to TB/HIV, and that is why we are making failures in relation to offering TB testing to a point in time whereby TB testing is being made a privilege, and yet we know from the human rights perspective, it should be a person's right to be able to get screened routinely for TB, especially for those people who are living with HIV. Secondly, except the few exceptions like the countries that have done very well in relation to TB/HIV, we lack the political commitment. And I think it's good that we seize this opportunity where leaders have gathered together to make a commitment to say we must address TB-HIV co-infection. What do we need to make a difference? One, I would want to acknowledge all the civil society voices seated in this room, and I would like them to stand up as I make this statement, if they don't mind. Civil society. I would like, as they stand up, I would like to acknowledge all the civil societies who have come up with a call to action in relation to TB-HIV. We were able to get 205 signatories from 67 countries. And I just want to cite an example of the country where I come from, whereby we have 2 non-governmental organizations that have driven the TB-HIV agenda in the country. One is the Kenya AIDS NGO Consortium that have made things possible to ensure that we continue raising the profile of TB and TB-HIV within the country. Secondly is the National Network of People Living with HIV and AIDS, which have continued to say that it is against human rights approach for a person living with HIV to be denied TB treatment. So I hope that you're going to recognize all the voices that are standing, and we do each and everything possible to ensure that people stop dying from TB and people living with HIV and AIDS have access to the testing. Thank you, and you may sit down.